My informative speech would be on stomach cancer. On January the 6th, 2020, my 93-year-old great-grandmother was diagnosed with stage 4 stomach cancer. She was sent home on hospice on January the 8th, 2020, so she could spend as much time with her family as she can. Most of us have had someone we love dearly to die. It's not a good feeling. I still find myself grieving a lot. I can't accept the fact that she is not really with me anymore. Having to take care of my grandma during her sickness was the best thing I could have ever done. In all the research I have gathered, stomach cancer takes you down fast. Today I will inform you on the importance of stomach cancer, how it can affect your overall health, and how if it can be treated properly. Stomach or gastric cancer develops in the inner lining of the stomach. This type of cancer typically grows at a slower risk of other forms, and it's easy to overlook the relative mild symptoms in the early stage. Stomach cancer produces different symptoms depending on the area of the stomach where it develops. Stomach cancer may not present with many symptoms in its earlier stage. When it does, individuals may feel valve, abdominal pain, and fullness, and varying levels of discomfort are brutally novel. During the last stage of gastric cancer, this can be due to a buildup of fluid in the upper abdomen. This pain may come and go, ranging from dull to severe. Indigestion is a general term that describes discomfort in the upper abdomen. Any type of irritation or inflammation in the area of the stomach can cause this symptom. Although it can be a symptom of stomach cancer, in most cases, indigestion is not indicative of a serious condition and can be treated with over-the-counter medication. It is not unusual for people to experience mild indigestions after eating a big meal or eating too fast. However, anyone experiencing repeated indigestion should speak to a doctor. A person who has stomach cancer may find they become ill more often. The immune system focuses on fighting the cancer, leaves the body susceptible to other illness and infections. Anyone who is becoming sick more often than previous should schedule an appointment to speak to their doctor, especially if they are experiencing other symptoms as well. Often those with stomach cancer experience a loss of appetite. The disease leaves people without a desire to eat for several days at a time. An unexpected loss of weight due to less abdominal consumption and the body's effort to fight the disease may also occur with stomach cancer. A common symptoms of stomach cancer is blood in the bowel movements. When the stomach or its lining bleeds, the fluid may collect with the rest of the body's waste. Stool with blood in it can appear almost black in color. While there are other causes of both dark stools and bloody stool, any significant changes to bowel movement should be medically investigated. Feeling tired can be the result of a myriad of conditions and factors. However, when one is sleeping significantly, feeling more tired than usual can be a sign of underlying condition. With gastric cancer, the tumor may bleed microscopically. The loss of small amount of blood can cause anemia and chronic fatigue. A fever is when the body fights infection. People with stomach cancer may experience recurring low-grade fevers. This is due in part of the malignant in the stomach and the immune system efforts to fight it. Fever is more common with advanced stomach cancer. Now that we know what stomach cancer and how it affects people's lives, we now know how to take better care of ourselves for a healthier life. A person who has stomach cancer may feel they become ill more often. Anyone who is becoming sick more often than previous should schedule an appointment to speak to their doctor, especially if they're experiencing other symptoms as well. Thank you so much, stomach cancer.